Welcome back. Dispatches this week turned its attention to AZT, or zidovudine, the only drug licensed in the UK specifically for treating people with AIDS. The programme stated that initial enthusiasm for the drug amongst AIDS activists had faded, and the drug had been either insufficiently or incorrectly tested under clinical conditions. It was also claimed that the damage caused by AZT's side effects may outweigh its benefits.
AZT was first developed in 1964 as a cancer chemotherapy drug. It was designed to destroy proliferating cancer cells. Later, at the US National Cancer Institute in Maryland, it was tested as an AIDS drug. Normally, cancer chemotherapy drugs are used for limited periods, but AZT is given for open-ended use. Its effect on the body can be very serious. Some people simply can't tolerate it and suffer vomiting, muscle pain, and unendurable headaches.
The programme also interviewed a number of people with AIDS who've become disillusioned with AZT. Although the testimony was very moving, some felt that other views were ignored.
The dizziness, the nauseousness, and the whole time I had fingernails that were so black, it looked like I had nail polish on, you know. And the upset stomachs, nothing tastes right, food or anything. And the main thing of it, it'll affect you so where you couldn't listen to people because you don't want to hear them because you're hurting so bad.
I've been living with AIDS for the last 2 years and have been taking AZT twice a day regularly throughout that time. I'm convinced that AZT has helped me to remain as healthy as I was before my HIV diagnosis. Personally, I felt the programme AZT, A Cause for Concern, consisted of a highly selective summary of the work of a number of self-appointed experts, and there was little in the way of hard evidence. I'm all in favour of discussion and investigation, but I felt the programme's single-minded approach did not offer a wide enough range of opinion. The only people who can really answer the questions the documentary sought to raise are those of us who have been and still are taking AZT over a number of years. The next time Channel 4 turn their attention to AIDS or AZT, why don't they talk to the people in the front line first?
Some callers praised the documentary, but others who work with people with AIDS have expressed anxieties. For instance, the balance of scientific opinion was weighted against AZT.
Critics of AZT argue that the benefit is not proven.
I would say that in most cases, or in a number of cases, you do see a small increase in T4 cells during the first 3 to 4 months. Usually by 6 to 9 months, if you're lucky by 12 months, you're back to where you started from. And from there on, there's, in most cases, a general decline, so that you end up with T4 cells less than beforehand.
Resistance to calls for more open debate about AZT has come from the US FDA, the medical profession, and the pharmaceutical industry. The FDA and Burroughs Wellcome in the United States, 2 doctors running the current UK Concord trial, and the Wellcome Foundation in the UK have all refused to take part in this programme.
A complicating factor is that controversy arose over a previous programme on AIDS made by the same production company. Complaints to the Broadcasting Complaints Commission about that programme were partially upheld. Subsequently, when approached to take part in this programme, some key experts and Wellcome UK, the manufacturers of AZT, as we've heard, declined to do so. Nonetheless, did the programme makers achieve an objective and balanced examination of AZT? With me is Joan Shenton, the programme's producer, and Simon Mansfield, a GP and consultant at the Kobler Centre in London. He's worked with people with AIDS for 6 years. It's an important debate about AZT, when it should be administered. Was this, would you say, a responsible and balanced assessment?
Well, no, unfortunately, I think the programme exploited people with HIV infection because I think they have an extremely difficult choice to make in whether or not to take AZT. And the programme used four, I think, sensationalist techniques, which made it I think it would make it very difficult for people to come to any kind of decision. But first of all, some of the information was just wrong. Secondly, there's the suggestion that there's some kind of cover-up between the pharmaceutical industry and medics. The third thing it did was that it used some kind of horror film techniques. And
what do you mean by horror film techniques? You mean the
Well, there was. We had a clip of it then. There was some kind of screaming. It sounded like screaming. It was synthesized music.
Yeah.
It used when you saw people with HIV, you saw X-rays. It looked like they'd just been exterminated by Daleks. These poor people. But finally, I think that there were double standards when it came to looking at the evidence about AZT.
Right, there's a large claim, so we'll probably have to go into some detail on some of them. But I mean, your whole point is that it didn't give a proper assessment as you would like to. Would you like to see an assessment on AZT on television in this kind of programme?
Oh, absolutely. I think that would be very useful and very important.
But this wasn't it. Joan, we haven't gone into any detail on those, but to those 4 points, what's your response?
Well, just to make a tiny point about something you said earlier, there were 33 calls after this programme to Channel 4. 10 of them were critical and 23 were highly supportive and said they wanted more information and congratulated Channel 4
I don't want to dispute that there were 33 calls. I think there probably have been more than 33 and there are still calls coming in.
I've counted everyone.
But as this programme goes out twice on Saturday and again on Monday and we are still getting letters and calls, I think perhaps to use that as any kind of measure of the response to the programme is not scientifically valid. As far as Simon's objections go, what would you say? That some of the techniques were sensationalist, that there was suggestions of cover-up, and that there was information missed out?
Well, I'd just like to ask Simon one question. I mean, Simon, you come from the Kobler Centre. Could you tell me whether in May 1991 you were the doctor that made the remark at one of your seminars, in a few years people will be laughing at the medical profession for prescribing such a toxic drug as AZT as a cure for HIV infection? Was that you?
No.
Well, it was one of your doctors.
Well, I'm sorry, I don't know anything about that.
Forgive me,
I don't see why there's so much criticism of a programme like ours when your very centre is deeply concerned about the problems that surround AZT.
Oh yes, I think there are a lot of concerns about AZT. It's certain there are side effects, and one of the problems with the programme, unfortunately, was that it confused issues about side effects. There were a great many problems with side effects early on because we really didn't know what dose we should be using. And the dose has come down to a third of the dose that it used to be. And since that's happened, we've discovered that side effects become extremely rare rather than common, as they were originally.
But does that surprise you? When you have a lower dose, you're bound to have less of a reaction, but that doesn't make it all right. There's no evidence whatsoever that AZT either prolongs life or that it actually improves quality of life. So what's the point of taking it?
What's very good is that we've discovered that despite using despite using a third of the dose, we're able to maintain people at the same level of health, and the reduction in dose doesn't affect the benefits of AZT.
Now,
There are benefits to AZT.
Is this, Simon, some of the information that you feel might have been in the programme, and because it wasn't there, that it was therefore misinforming?
Yes, that was one of the elements about the information that doesn't help people to make up their minds.
Let me just select the information. Simon just said there are benefits from AZT.
Yeah, that was one of the interesting things about the programme, I think. When you look at what you did was discussed absolutely correctly with good scientific rigour the early trials of AZT, and you said that there may have been some loss of blinding in the early trials. And
There's proof that there was?
Yes, I think it's very likely that there was. Right. But what's interesting, you then said, well, therefore, the trial's a complete waste of time, you can't pay any attention to it whatsoever. No, actually, that's not true. In actual fact, blinding wouldn't affect survival time, whether you knew or didn't know you were taking the drug. Your survival time would
Simon,
be the same.
the survival time we discussed from another trial, not that one.
The
one
veterans
Dr.
trial.
Hamilton's just produced, which says there is no difference in length of life if someone's given AZT early or late in the disease. That is terribly important.
Right.
You know, people taking AZT think it's really going to do them good and they're going to live longer. That is very irresponsible.
No.
There is information doctors should be giving patients.
You mentioned John Hamilton there. That perhaps brings us on to one of the other points you made, which is about double standards. And as I understand it, you feel that the programme made certain charges about studies and then didn't seem to commit the same fault itself.
Oh, well, I think the Hamilton paper is a case in point, because actually it was only published yesterday. So people like me have only had 24 hours to see it. So until yesterday, in effect, hadn't been peer-reviewed, which, of course, is an important criticism. And yet, Joan, you decided to keep...
Can I please tell you something?
To use that.
That is absolutely wrong, what you said. It has been peer-reviewed for over a year by the
But none of us
New
have been able
England
to see,
Journal
yes,
of
but none of
Medicine
us have been able
before
to see it
proper
until
publication.
yesterday morning.
But that's not my fault. I'm a journalist
you've
bringing
been-
you new information. You should be grateful
And
as a
I'll tell you what
doctor.
that paper
You should
said.
be grateful.
Joan, the paper said that people should take AZT. It didn't. It said we're not sure whether they should take it early or late, but it said people should take AZT.
It said-
It also used doses of AZT, which were the old doses, and those people were having to do the 4-hour business, you know, taking
Right,
your
look,
drug every 4
this
hours.
is getting
And we're now
technical.
down into
Right,
But
much
can I
lower
just say
doses.
that as
It's-
a doctor, you need to have the latest information.
Yes,
We
I
are
agree.
bringing it to you. We're bringing it to you before you even know it exists.
Sure, can I ask you a question about
Therefore, I know
documentary
that
technique
Channel
just a minute?
4
When
I
you
just
set
want
out to
say
make
that
the
I
programme,
want to be
was it
helpful.
yes, I understand that, and I'd like you to explain to
wanted
the
to
viewers
say-
who are watching, when you set about this kind of documentary, how do you do it? I mean, are you setting out to prove that such and such a thing is the case, that AZT is not all it's set up to be, which is something that you've worked on before, or to look at all the new evidence again
Of course.
and come to a
We've
completely
spent
objective
4
conclusion?
years researching this film. We have spoken to the top experts across the world. We know all the Freedom of Information secret documents that Simon hasn't had a chance to see, which show how the early trials were flawed and were dishonest, and we even have seen evidence that they Tipp-X'd out some of the information without the trial supervisors knowing. Now, Simon can't be expected to know that. What I'd like to say is that we are bringing new information to you and to patients. And Channel 4, and dispatches in particular, would be delighted to send transcripts out to any doctors who would like this information.
Right.
It's important.
Well, I'd like
Final
to be
word.
very clear. Oh, the final word
I'm afraid
already?
so.
Goodness me. Well, in my clinic yesterday, patients were coming in and they were saying, actually, this wasn't any new information. There was no information. But I actually felt scared watching that programme. There was nothing I hadn't heard before, but I felt scared. Now, I think that a programme talking about AZT should be giving balanced information for people with HIV so that to help them make a decision, not playing scary music in the background.
What do you mean by balanced information? We're bringing new information.
What would you say to that?
I think the new, so-called new information isn't new, and you're misrepresenting some of that information. The Hamilton, the veteran study is a case in point. You've completely misrepresented the results of that
Do you regret that
study.
you have scared
We
people?
interviewed the doctor
Joan?
who ran the trial. How can you possibly say we misrepresented it? He's happy with what we said.
But you
Well,
have
last
frightened
time you-
patients.
I think patients need more information. They need to discuss these things with doctors like Simon, and they therefore
Right.
should have this information in their
The
hands
debate is
to
on.
discuss.
Thank you both for joining tonight.